Hi everyone, Craig Stevens, Spokane Sports and Physical Therapy. Physical therapist now for 27 years, licensed and registered here in Washington State. Yes, Washington State. I want to talk to you today about sciatica, sciatica, as a lot of my patients like to say. Common problem. I want to first of all talk about what it is, some of the simple things that start it, get into what to look for, and then finally get into how to help in the initial stages of sciatica. And if those don't help, what do you do? All right, it's my friend Fred here. First of all, a footnote. People have told me to let my personality come through. I don't have much of a personality, so we'll struggle with that. Second of all, don't be a dumbass and smash your finger if you're a physical therapist, because you know better. All right, enough said. Smashing a concrete block, enough. All right. So, the sciatic nerve. Basically, the sciatic nerve is made up of a congregation of nerves that come out the back, go down the back of the leg, all the way to the bottom of the foot. Now, the primary nerves that we look at are L4, L5, L5, S1. Those are the main nerves that make up this. To a lesser extent, L3, L4. Not much in L3, L4. And then you have the sacral nerves that come down. Now, what happens is people wake up and they'll have pain into their hip, down the back of their leg, and think they pulled a hamstring or something. They'll go to get up and, oh, I've got pain in the back of my leg. Oh, they'll have burning, or they'll have tingling, or their foot will feel numb, and it feels weird. Now, a footnote here. If you wake up like that and you go to get up and you can't move your foot, you can't pull your foot up or your foot drags, that's called foot drop. Get to the emergency room, get to urgent care, have that looked at. That can be really important. That can be neural shock, neural trauma, but what we worry about is compression of that nerve, not allowing the muscle to work. That's very, very important. Second part of that is if you have lost bowel or bladder function. I don't mean that, hey, I wet the bed or did this, but no, you can't control. That's a different type of problem. That needs to be looked at too. So, similar symptoms along with sciatica. All right, sciatica. Sciatica can be caused by a lot of things, but the first thing we look at is the muscle which overlies right here this nerve. The nerve is deep. There's a muscle here called the piriformis. You'll hear that a lot, piriformis syndrome, blah, 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 blah. Organ and piriformis syndrome at some point in my series, but right now we're dealing with just acute sciatica, all right? So what happens is this nerve is inflamed for whatever reason, whether it's a disc problem up here, the joint's out of position, the muscles have pushed down and compressed the nerve. Now, the sciatic nerve, even though it's made of multiple nerves, can be 1, 2, 3. Usually it's only 1 or 2 of the nerves that are involved. So it's hard sometimes to isolate it out with symptoms. But if you have pain, tingling, and burning down the back of your leg, not the front. The front's a totally different nerve. That's a different video. Sciatica, that's what you normally have. Now, sciatica, another note, excuse me, is normally unilateral. One side. If it's both sides, you've got something else likely going on. A lot of my patients come in and it's mostly on the left and some on the right. But if it's primarily on one side, unilateral, sciatica. All right, so what can cause sciatica? Normally sciatica is related to something you've done in days prior. Okay, people normally wake up with this. And the reason why you wake up with this is inflammation normally occurs kind of over time. It doesn't just happen right away like when you smash your finger with a block. So inflammation sets in, and at night when you go to sleep, there's nothing to stop it. Muscles aren't pumping that fluid out of there. So the inflammation just kind of builds, and then you go to get up, and it's like, oh my gosh, what the heck happened to me? So, and you think, must have slept wrong. Well, no, you really didn't sleep wrong. You just went to sleep, okay? So it's usually a lifting, bending, twisting injury. I was wheelbarrowing a bunch of rock. I was digging in my garden. We built the fence all day. We put in a sprinkler system before we smashed our fingers. All kinds of stuff like that. But it usually has some kind of causative event in activity. Now, a lot of my patients are anymore with everyone working more from a desk, sedentary positions. They go out and they work out in the garden on the weekend. They do a bunch of stuff on the weekend. Monday morning they wake up, Sunday they wake up and they have symptoms. Their bodies aren't used to that. Okay, so there's a lot of things that can cause it. So don't get freaked out by sciatica. That's why I'm here making this video. So sciatica usually has a causative event. Now, the things that lead up to that are lack of activity, degenerative disc disease, arthritis. All these things kind of slowly build up and are additive. They work together, not one, oh yeah, I popped my sciatic nerve. No, that's not the way it works. Okay, so we get compression, we get irritation, we get restriction somewhere as these nerves come out and make this bundle of the sciatic nerve. Now, red signifies the fact that this is inflamed. It's inflamed. Okay. Yes, I pronounce things incorrectly because I'm trying to emphasize a point. Okay. It's inflamed. All right. So we gotta get the inflammation off of there. A lot of people will resort to over-the-counter stuff, but usually this is a mechanical problem. So you've got to do something mechanically to reduce this. All right. So the first thing I tell my patients is you got to stop doing whatever dumbass stuff you did, right? Sorry about the language. If you were digging a ditch or moving rock or something, you wake up on a Sunday and you've got sciatica, your leg is hurting, your back pain, you can have back pain with sciatica, you don't have to have back pain with sciatica, leg numbness down the leg, don't do what you did the day before. Don't go out there and finish your project. Again, these things are additive. It makes it worse. Okay, now, if you're wise and you back off and you listen to your body and you say, you know, honey, I don't think I can do that today, you'll probably save yourself a trip to the emergency room, trip to me, because normally this stuff builds and builds and then it's untreatable. So if you give it a rest, if you allow the inflammation to come down, and don't just expect Advil to get rid of your inflammation in your sciatic nerve, because it's not. Let the muscles relax, you'll get better. All right. So one of the things that happens, whether it's a disc irritation, a joint irritation, or irritation at the SI joint, which I see the most common problem as, which leads into piriformis syndrome, and if you're a therapist, you'll figure that out really quick what I'm talking about, is the muscles will then compress, pinch this sciatic nerve. All right? What do you do for that? Well, rest, right? That's the first thing. Second thing, ice. Ice, 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 baby. All right? Ice seems a little counterintuitive because muscles tend to get a little tight with ice, but ice actually reduces the contractile ability of the muscle over time, plus it reduces swelling. That's what we talked about. You've got inflammation. Ice reduces that. All right. The second thing I tell them to do is, in combination with the ice or alone, get in a 90-90 position, something like this. You lay down on your back with your legs up and across. This takes pressure off of that sciatic structure, takes tension off the sciatic nerve. One of the ways we test the sciatic nerve is we put it on stretch. So if you're bending, okay, you're bending, your sciatic nerve is now on stretch. Okay? If you're laying there and you're stretching like this, don't do that. Don't do a hamstring stretch. That'll upset that nerve even more. Get in a 90-90 position very simply, preferably with ice under your back, and just lay here for about 15-20 minutes. Okay? Do this 2 or 3 times a day. This takes pressure off of the spine, off of those structures, allows the muscle to relax, and it will give it time to heal, because you need time. People tend to get, well, give me a shot, give me a pill. No, this just takes time. And if you're smart and you're wise, you give it about a week. I tell people 5 to 7 days, it will usually significantly improve. All right? Now, a footnote on the improvement. If it does not improve significantly, come here, Fred. If it does not improve significantly, it's worse and worse and worse, get to urgent care. Go have it looked at. And what I mean by that is if it starts going farther and farther down the leg, or man, my foot feels weaker, or I'm starting to stumble, get to urgent care. Okay? Now, if you don't have a stool and a bed, I tell people get down on the ground and get your legs up onto your couch, onto a chair, something like that. Okay? That will help alleviate the pressure. Another thing I hear a lot is, well, what about traction? Do I do traction, or do I do the inversion tables? Inversion tables, I have found clinically, they make people way worse, especially in the acute phases. If you have chronic arthritis and you're a fairly rigid individual, the inversion stuff can help to a degree, but not in the initial stages. If you want to make it worse, do an inversion. And unless you've done it before, it will usually make it worse. Traction does not pull things away, because like we talked about, where there's inflammation, there's swelling. You've got to reduce the swelling. You want pressure off of it, but you can't pull it apart. The second thing is, with compression, with irritation, the muscles are tight. Muscles are inflamed and irritated, and they're actually pulling and compressing whatever structure is irritated and upset. That's the body's reaction to this problem. So sciatica, again, what is sciatica? Sciatica is inflammation of the nerves that come out the back and go down the back of the leg, bottom of the foot. All that stuff is involved. Now, L4, L5 wrap around the foot, but definitely if you have something in the front of your thigh, that's not sciatica, that's different. Doesn't mean some of this stuff won't help, but that's different. So sciatica is inflammation of the sciatic nerve. Second of all, you want to watch for acute compression, which means you're in intense pain or you have foot drop. Along with that, you can have loss of bowel or bladder function, which is not sciatica, that's something totally different. But you can have leg pain with that syndrome as well too. Those three things, if you have, get to urgent care, get to the emergency room, have it checked out. Other than that, 5 to 7 days of ice, rest, and then reduced compression makes a big difference. And usually within 3 to 5 days, people kind of clear out, especially in first few times. One final word. The biggest thing I see with people is they don't give it time to heal. They go back doing the same stupid thing, and it makes me money, and I appreciate that, but that doesn't do people a whole lot of good. So, all right, have a nice day. Craig Stevens signing off, physical therapist, Spokane Sports and Physical Therapy. Have a good day. Bye.